Silent EMA hepatitis C. The viral hepatitis is a systemic disease with primary inflammation of the liver caused by any one of the heterogeneous group of hepatotropic viruses. Worldwide, about 1 million people die each year from the causes related to viral hepatitis. Even though the discovery of hepatitis E and hepatitis B had been a critical step forward, the majority of blood-borne hepatitis remained unexplained until the discovery of hepatitis C virus. The 2020 Nobel Prize for Physiology and Medicine was awarded to Harvey Alter, Michael Houghton, and Charles Rice for the discovery of hepatitis C virus. Now, let's turn our thoughts to this silent killer. Hepatitis C virus infection is one of the primary causes of liver cirrhosis, hepatocellular carcinoma, and liver transplantation. The rate of HCV infection is high in patients on hemodialysis and HIV. The hepatitis C virus enters the body through blood, making the liver its battleground, and hides in the liver cells, slowly damaging the liver over years, finally leading to cirrhosis and eventually hepatocellular carcinoma. The Center for Disease Control and Prevention has termed this disease as a silent epidemic since 75% of the infected are unaware that they are carrying the virus. It is estimated that around 150 to 200 million people, or 3% of the world's population, are living with hepatitis C, leading to 400,000 deaths annually. Hepatitis C is prevalent in India too, with an estimated 12.5 million cases. The hepatitis C virus belongs to the genus Hepacivirus and family Flaviviridae. It consists of a linear single-stranded RNA enclosed within a core and surrounded by an envelope carrying glycoprotein spikes. It consists of 6 distinct major genotypes and 1 minor genotype, of which the genotype 1 is most common worldwide. Hepatitis C begins as an acute infection after exposure to the hepatitis C virus. 20 to 25% resolve spontaneously, but 75 to 80% will progress to chronic infection. The signs and symptoms range from asymptomatic to fulminant and fatal acute infection. Over many years, inflammation of the liver tissue leads to scar tissue or fibrosis, which leads to cirrhosis and further liver damage. Mode of transmission is mainly through blood-to-blood contact. The diagnostic tests for hepatitis C infection include HCV antibody using ELISA test, HCV RNA using PCR, which is the most sensitive test, and HCV antigen test. Immunoglobulins are ineffective in preventing hepatitis C. Hepatitis C vaccine to the envelope protein is currently not practically feasible. This is because of the numerous genotypes and viral heterogeneity. In acute hepatitis C, only supportive therapy can be given. In chronic hepatitis C, monotherapy with IV interferon was the mainstay of treatment in the past. However, it had many side effects and it gave disappointing results, with response rate of just 25%. Currently, the treatment of choice are the new DAAs, that is, the directly acting antivirals. Clinical trials have shown that interferon-free DAA-based therapies, which have an efficacy of 95 to 99%. They are safe with minimal side effects and a shorter treatment duration of 8 to 12 weeks. Commonly used DAAs are NS3 or 4A protease inhibitors, NS5A inhibitors, and NS5B polymerase inhibitors. Sofosbuvir, a nucleotide analog, is a potent drug with excellent tolerability and pan-genotypic activity. The latest development is OCV, which is a polypill in a single tablet. There has been speculation that with OCV and other treatments in the pipeline, we are now approaching the ultimate WHO goal of eradicating HCV by 2030. However, we should remember that the DAAs are only a cure and not a vaccine, so we can get reinfected if we put ourselves at risk. Acute hepatitis C is a rare event in pregnancy. The most common scenario is the chronic hepatitis C infection. The overall rate of mother-to-child transmission for HCV is 3 to 5%. Co-infection with HIV increases this rate of transmission to 19.4%. Women diagnosed with chronic infection during pregnancy are generally not treated since these drugs can cause birth defects in the newborn. Currently, universal screening of all pregnant women for HCV is recommended. The general measures of prevention include screening of donors before blood donation, organ transplantation and dialysis, adequately sterilized medical equipment, promoting safe sex, raising awareness especially among the high-risk population, and children born to infected mothers should be screened at 2 years. After completing the treatment for hepatitis C, the patient should be vaccinated against hepatitis A and hepatitis B virus to prevent further liver damage. Response to treatment should be followed up 3 months and 6 months after completion of the treatment using the sustained virological response test. Most of the drugs are effective only before cirrhosis sets in. So, the real challenge is no longer curing hepatitis C but identifying those with the disease because many are infected but don't know. Focus should be directed towards working with affected communities and scaling up and linking prevention and treatment programs. Although a hepatitis C vaccine is still elusive, the discovery of this virus has allowed rapid development of highly sensitive blood tests and potent antiviral drugs capable of curing the disease. With global efforts, the eradication of this virus is an achievable dream. To achieve this goal, international efforts facilitating blood testing and making antiviral drugs available across the globe will be required. Together, let's eliminate hepatitis C.